Okay, folks, keep your heart pumping and your body moving. Two pretty good ideas right there. We're talking heart health with Dr. Andrew Hornak. He's a cardiologist from Summa Health with a special interest in sports and exercise cardiology, cardiovascular imaging, and cardiovascular disease prevention, and a whole bunch of stuff. That's a big, long list.
Yeah, it is. Thank you for having me. It's great to be here.
Yeah, it's good to have you here. Hey, so, I think about cardiovascular problems and all that sort of thing. I think about older people, the heart, and all that, but things happen way earlier. You're talking about sports here. How does that work?
Yeah, great question. We do have a clinic that is focused on athletes, people who are highly active, and that's an area of interest that I have. And that definition is important. Who is an athlete? Who is a highly active person?
Right.
That could be somebody in the community, not just our collegiate athletes, but older folks who are competing in marathons, triathlons, or highly active people who have jobs that require them to be active. Emergency services, police, firefighters, those kind of folks. And the goal of our clinic is to get them in, if they're feeling some sort of symptom, try to quickly, but also safely, identify what's going on and then get them back to doing what they love to do.
Yeah, it would sound to me like we're talking about, we're identifying a problem that might be with a younger person or a person who appears to be in great shape, who likes to play sports. What kind of signs are there that they go like, oh, I better come over and see the doc?
Yeah, that is the key to what we work on. And sometimes the hard thing is that somebody who is very active, sure, they can go and ride 50 miles, and somebody might say, oh, well, you're fine then. But if they're feeling something that's limiting them from achieving that level of exercise or performance that they're used to, that's what we're really trying to work up. Some of the symptoms that we focus on, things that would be big red flags for me. Maybe chest pain would be one that really gets my heart racing. If somebody's telling me about that's coming on with exercise, anytime they give some sort of effort, they're having chest pain, and the only thing that helps it is to stop exercising. Other symptoms certainly to be aware of would be something like feeling like you're going to pass out or actually passing out at peak exercise or just after exercising. Those are definitely times you got to see some sort of healthcare provider.
Well, and in your practice, are we talking about younger people, younger middle-aged people, rather than much older people? Because you wouldn't expect that to happen to you if you're young, healthy, and you're an athlete. You probably ignore some symptoms.
Yeah, great points. And this is, we're seeing people kind of throughout the lifespan at any age. And there is sort of this, the thought process is, hey, if you're highly active or if you exercise a lot, you can't get sick. But that does happen, unfortunately. Even you can't out-exercise some of the diseases that we have, and so it's important to look out for those signs.
And some of those diseases we're talking about are mechanical. I mean, it's not even like a sickness that comes on.
You bet, yeah. And there is kind of a cut point that's been made, about age 35. Above that, we think of people as sort of those masters level athletes, older folks. And under the age of 35, there is maybe a different spectrum of illness, things that you're born with that can show up at those young ages. Whereas, above the age of 35, it's more of the conventional heart disease we see in middle-aged folks.
And old-timers like me, I remember in the beginning, when I used to be able to run around a lot and do a lot of things, people would say, play through the pain. Well, play through the pain might not be a good idea.
Yeah, that's right. I think especially if it's something that's limiting you from doing what you expect to be able to accomplish at the intensity you expect to be able to do it, you got to get checked out. Don't just push through it.
Yeah. So sometimes, I do these segments and I go like, well, you maybe should check in with a cardiologist or a doctor ahead of time. But in this case, we're really talking about you should have a symptom or a sign or something to look for. What are some of those symptoms? What are some of those signs? What should people be looking for to think that I better go see the cardiologist at Summa?
Yeah, that's a great question. Sometimes people come to us because there is a symptom. And whether that is shortness of breath, chest pain, feeling skipped beats, feeling like you might be passing out, those are important things to get checked out for. But if I were to give anybody who's watching us some advice, it would be know your own cardiovascular risk factors. And really, by the time you're in your 30s, definitely by the time you're in your 40s, you should see a healthcare professional to get checked out. Make sure you know what kind of modifiable risk factors you have.
30s or 40s, should people be monitoring their heartbeat at all or monitoring their blood pressure at all? Because usually you think you're bulletproof back in those days.
That's true. That's the tough things. Everybody thinks they're invincible. But yeah, definitely by those age ranges, you should be getting checked for your blood pressure, usually some basic lab tests, know your cholesterol, your blood sugar, things like that.
Just for baseline, so you have something to measure back to when you're older, right?
Absolutely. And our toolbox for things we can do for cardiac prevention is getting bigger and bigger. We have all sorts of things that we can do to help to risk stratify people for disease. And so it's helpful to get checked out so we can identify those people who have some risk.
It's good to know you.
Yeah, great to meet
talk
you.
to
Yeah,
Thank you very much. There's some
Absolutely.
good advice, folks. Okay.